Many of the people who suffered most during the pandemic were frail, elderly and vulnerable. Around 1 in 3 deaths from COVID took place in care homes. And we now know that during the first wave of the pandemic, patients taken from hospital and moved into care homes without being tested. Mike Padgham is chair of the Independent Care Group. Mike Padgham, can I take you back a year and a bit? Talk to us about running a care home in those first weeks of the pandemic, trying to keep your residents safe, but also having to cope with arrivals from hospitals without any real way of knowing that they weren't bringing the virus into your care home.
Good morning, Trevor. Can I just extend my condolences to all those people who've lost loved ones in care homes or elsewhere in the country, for that matter, because it's been a tragedy. Yes, at the start a year ago, it was very, very difficult. We were told by the department late February, actually, carry on as normal. There's no reason why we think it's going to affect you. But we could see what was happening in Europe, and we, as a provider, actually locked down much earlier, actually on the 11th of March, because we could see what was coming. But reassuring staff and relatives and visitors was very, very difficult, because at that time, no one knew what was actually going to be happening. It was frightening.
I want to show you, I don't know if you'll be able to see it, there's a graph of the excess deaths over the last year to February in care, or people who had been in care, of people who'd been in care homes. And last April, the peak climbed to 6,000. I mean, normally it's, down around a quarter or third or a fifth of that. Tell me what you felt during that spike. I mean, it must have been mayhem.
Well, it was. I mean, we had someone who was transferred to us from hospital actually on the 19th of March. At that time, we thought testing was happening. In fact, we found it wasn't, and we actually had to go and get the test ourselves from the hospital to test that person to make sure that they weren't positive. By the time we got the test, we subsequently found they were positive, and they were readmitted back and unfortunately passed away. Yes, it was dreadful. We were worried because we saw the NHS was dealing with a very difficult issue. They had PPE, we didn't, and it was reassuring our staff and our residents that we knew what was happening and doing the best we possibly could. But it was frightening. And if it weren't for the hard work of social care staff, and in fact the local authorities in our area, those figures, I'm confident, would have been much, much worse.
Mr. Cummings said this week that when Matt Hancock said he'd put a shield around care homes, he was telling untruths. Somebody is not telling the truth here. Hancock says he wasn't lying. Who do you think was telling the truth?
Well, I can only give it as I see it, and I don't want to accuse. I weren't there to hear who said what to whom. All I would say is I don't believe myself there was a ring of protection thrown around us in those very early days. It was difficult. We were forgotten. We've been forgotten over decades. That's the only issue in social care. We weren't prepared. We weren't ready. We didn't have the PPE. We didn't have the testing. And it took the government many, many weeks to actually see what was happening in homes. Despite our best efforts and protestations, that is why providers, I think, without their efforts, the figures, as I said just now, would have been much worse. So they take some credit, particularly the staff, of course.
Of course, there was a crisis in social care before COVID, and there is a crisis in social care now. And unless we do something about it, there will probably be a crisis in social care in the future. What do we need to do now?
Well, it's so frustrating, you're right. And I've lost faith in all politicians, really, because going through Labour, the Coalition now, and Conservatives, everyone's promised something and it's never happened. I'm at a loss to know what we can do in the future. All I would say, if something positive came out of this pandemic, it's got to be the reform of social care. And rather than people stepping down now and resigning, I want the government to actually give us a date when they're going to deliver social care, not move from it. If they don't deliver this time, then they need to step aside and let someone else do it, because we've run out of patience. It needs action today.
Mike Padgham, thank you very much indeed.